Hello, doctors. We're here with the great Bianca Hassoun, formerly from Maryland, now in Illinois. We miss you, but we're glad to have you here today. Bianca had a very important question because many doctors get, I think, intimidated when they see us playing with attachment designs, going for getting the right vector from the right angle. And it can be intimidating also to present a case to a parent, and you don't know how it's going to turn out. And the parents don't know what's the level of compliance going to be. These are some of the most common things: the doctor anxiety over what their mechanics are supposed to be, and also the anxiety of the parents in terms of what their compliance is supposed to be, and then the doctor's anxiety over the parents' anxiety and over the compliance. All of these things can lead to sort of a stress ball that can actually be a disincentive for treatment. And I want to do away with all that. So this is really important. So Bianca, we're going to lower the temperature and take a deep cleansing breath. And we're going to say the following. I want to take the most stripped down, bare bones case that you could possibly take and show you what can be accomplished, even if we paid no attention at all. That's not our intent. So we're doing now the opposite of what we do in the course. In the course, we're trying to make everything 100%. How much can we get if we didn't actually apply ourselves to every detail of the case? So this is an example of what could happen. You'll notice the dates over here. When you go on the Align Oral Health Suite in the iTero, you'll see, right, the dates, and you could do a comparison, which is very valuable for us, for parents, obviously. So December 29th last year, December 24th. So that's 2 days ago as we speak today. We're in our holiday break, December of 2025. Well, as fate would have it, this patient is like a family friend who only sees me in holiday break. And they don't even see me in the office. They come to my living room. I have a portable iTero. I saw them last year. I said, no, 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 no. You need these aligners. You're a friend of mine. I'm giving it to you. Don't even talk to me about money. We're going to give you these aligners because you absolutely need it. Patient said, okay. I mean, if I absolutely need it, when do I need to wear it? I said, nighttime only. Mind you, this patient wasn't even 6 or 7 years old. Usually between 6 and 8 year old, I'll always say nighttime only. And that is been very, very successful. And I haven't even seen any drop off in quality of the work. But this patient wasn't getting attachments either because they weren't being seen in the office. I can scan in my living room. Bonding attachments in the living room is a little harder. So I'm not giving attachments, and I'm telling them nighttime only. And they're even a little bit older. They're like 11 years old, as you'll see. Did we get any results from nighttime only? We had to give them, Bianca, when I showed you this case just now, you told me how many aligners. So we gave them once per week. So call it 50 aligners. Okay. Maybe it was 40 aligners and they wore it a little slower, but something in that neighborhood. Okay. And then I see her a year later. So let's see what we actually got out of it. Um, okay. So on the upper, you see, and this is really possibly the most important thing I could show you, the arch development actually happened. You might be able to see that you're seeing more of the buccal surface of the centrals. You're seeing some correction here on the rotation of the lateral. Now, it's not exquisite. It's not perfect. We don't have spaces around the canines like we sometimes like to have. There's certain aspects here that are not our ideal. But overall, a very, I think, meaningful correction. The same would be on the lower, right? Where you're already starting to see the transitional dentition. And on the lower, you're seeing some correction of the lower crowding, right? We didn't extract canines or anything like that. We're getting lower crowding correction. Perhaps most profoundly, you're seeing over here, and this maybe would account for the fact that in the anterior, you're seeing a midline correction. I mean, that symmetry, I don't know how we ended up with that space between the centrals, but it speaks to the extra space that we got from this treatment and the symmetry, right? Opened up the bite and got her from a pretty asymmetrical bite to a symmetrical, beautiful bite. So arch development, symmetry, and look at this. Sagittal, molar positioning, sagittal correction, as well as this patient was in a posterior crossbite on the left side that has been resolved. Wow. So have we accomplished anything by bringing her into my living room? This is the patient that had she walked into an office, an orthodontic or pediatric office other than my living room, may have, if this patient had walked into Somewhere else, they may have just been sent home, or maybe they would have been given an RPE, which may be the appropriate treatment. But by having walked into the living room, look at the difference in the symmetry. Here's the midline over here. Her oral hygiene even looks better, which we tend to see in our patients, which can't be dismissed. So you're seeing what I consider to be subtle but profound changes. And this we see all the time. So what percentage of correction would I say we get in this case? Maybe we call it 70%, 75%. It's a lot. Why? Because now the teeth are going to be coming into a more balanced area. There's arch development. And again, as we demonstrated, transverse, sagittal, and vertical correction. What more could you ask for? Were we to stress ourselves out and get super intentional as we do with attachment design and things like that, it would be more exquisite. But what I want to bring home from this case is in the most basic way, even with nighttime wear only and no follow-up for a year, you are capable with this particular treatment modality of getting arch development and arch balance and space management, the most critical things that you would want. Those are the most critical objectives for this stage. Arch development, arch balance, and space management can be achieved just with the exquisite and profound capabilities of this treatment modality. And so I think that that really behooves everyone to use this treatment modality in order to achieve those things and to start. And as your expertise grows through our community and through our ClinCheck cafes, get better and better and better results and be able to handle more and more difficult cases. But at the very base level, any patient that you have that's coming in with this, just know that you can start and that even without the full complement of knowledge and expertise, you'll still get a tremendous result for this stage for this patient. So thank you for your question, for sharing your thoughts.